All right, knee joint rehab. So when you're doing a rehab program, remember we want to make sure it's individualized for every single athlete or person. We need to incorporate physiological as well as psychological interventions, especially with knee injuries. Sometimes they're long term, and therefore we want to make sure that we're addressing all the issues. You can be held back just as much mentally as you are physically. You want to be specific on the individual needs and also sport specific on what they need as well. So on general body conditioning, so remember we want to always make sure that we're working on general body conditioning even when they're non-weight bearing and they can barely move their leg. Their leg is broken, their upper body, their torso, their arms are not. So we want to make sure that we're using any and everything that we have, meaning an arm bike, aquatic, swimming, stationary bike, depending on the range of motion, but you want to continue to make sure that they have cardiovascular endurance and levels are not affected as much as we humanly possibly can, so that when they return to sport, they're not behind the 8 ball. So we also want to make sure we keep strength and flexibility and proprioception during the rehab process. So joint mobs. We talked about joint mobs in regards to ankle, same thing in the knee. So especially after knee surgery or any type of non-movement or casting or anything like that, you're going to have issues with the patella kind of adhering and not moving the way it should. So you want to work on medial, lateral, superior, and inferior glides. And this is also one of the reasons why they use what's called a CPM machine immediately after knee surgery. It forces your knee to bend and straighten to kind of keep that knee cap patella in line, and also to prevent any adhesions. So when we talk about patellar glides, we're literally, when you sit down with your legs straight and you kind of play with your kneecap going in different directions, that's really all it is. So you push your kneecap all the way laterally and then just oscillate there, small little movements, and then relax. Or if we need to do superiorly or inferiorly or medially, depending on the situation. So all these are just examples of that. When we talk about posterior femoral glides or posterior tibial glides, so that's more of the knee joint, not just the kneecap. So those you have to move the whole knee joint. So putting a bolster underneath them helps. So if you notice that first picture for posterior femoral glide, the femur is wanting to go posteriorly. So you stabilize the tibia and then you give it a little bolster or pillow underneath so it has some area to move, and you push down posteriorly through the femur. Posterior tibial glides, same concept. You put them in a slightly bent position and you want to work on pushing with both hands through the top of the tibia because that's the broadest point. When you're working on posterior tibial glides, you're helping with their flexion. So if they have a reduced knee flexion, you want to do posterior tibial glides. If they have reduced knee extension, you want to do the posterior femoral glides. So femoral helps with knee extension, tibial helps with knee flexion. So this is what I said, the CPM machine, that's what it looks like. It's a kind of a crazy looking contraption, but it keeps your leg and foot and knee in alignment the entire range of motion that you have, and you can set it to whatever range of motion you want it to go to. So if it's a small amount or a large amount, it can do it all. Flexibility. You want to make sure, especially when it comes to the knee, that you work on flexibility initially, immediately, as much as humanly possible, because you cannot walk without a limp without full extension, and getting the extension back is incredibly hard if you don't do it in the very beginning. So you want to maintain and improve flexibility of all the muscle groups around the knee, and doing this with active range of motion exercises if possible. So for instance, when we talk about stretching, PNF stretching, it's a type of stretching where there's different components to it. So when you're stretching your hamstrings in this diagram, like you're laying on your back and someone's pushing on your leg straight up, that's a passive stretch. While your leg's up there, you're going to contract against it, and they're not going to allow your foot to move. Then you're going to relax and you're going to get a little bit more stretch. That's called PNF stretching. So that's one way to help with flexibility. So when we talk about muscular strength, remember we want to have the progression. So our progressions start with isometric, then move to isotonic. Remember isometric, straight leg raises, quad sets, where things aren't moving or changing the angle. Isotonic is concentric and eccentric, so the angle of the knee is changing. So later on, the more plyometrics, get that fast acting, quick motion. When we talk about closed kinetic chain versus open kinetic chain, closed kinetic chain is considered safer and much more functional than open kinetic chain. However, there's certain things that are open, i.e. single leg raises or quad sets, that are what you do in the initial component. But when we say closed kinetic chain, it means basically the foot is in contact with the ground or some other type of stabilizing force. So we want to include that, and that's more functional because in reality our foot is normally in contact with the ground. Eccentric quadricep contraction is incredibly important because this is what decelerates us with running. Eccentric hamstring work is necessary because it's what decelerates us when we're kicking. So if you're kicking, your leg has to stop. So their hamstring is what's going to stop that on the eccentric load. And if you're running, what stops you is the eccentric load of the quad. So these are just a couple examples of what I'm talking about when I say single leg raises. You notice they're open, but very little resistance. Or quad sets, it's you tighten your quad and you're pushing your knee back through the table. Concentric versus eccentric. Concentric, remember, we're shortening the muscle. Eccentric, we're lengthening the muscle, but still with resistance on both ways. With bands, you get resistance a lot of times in both directions, so that's incredibly helpful. Notice the guy for eccentric, if he were to extend his knee fully, like kick out, he has resistance from the band, but the band's not going to give him any resistance on the way back. So that's why the other guy has a towel around it. He's giving resistance on the way back. Mini squats, step ups, other very common and very good exercises to do. Lateral walking, as well as using exercise tubing. Those are also ways to work on strengthening. Notice how she's having them do a mini squat on balance with a tube. So it's really working on figuring out different exercises to increase the muscle strength and to make it more dynamic. So say she lost her balance and following inwards, but she's got to maintain it. That's what's going to help her with that exercise tubing. And remember, there's always a functional progression. So activity-specific skills, you want to break them down in components and gradually reintroduce them. Meaning, for instance, walking. You're going to first start with forward and backward walking. Then you're going to add straight lines and then curves. Jogging, same thing. You're going to start straight, then add curves, then figure eight. Sprinting, you start straight, then you add curves, then you add large figure eights, then small eights, and then maybe a zigzag or a carioca. There's all different levels. Return to play. When we choose return to play, remember we want to make sure that there's been a sufficient amount of time to heal the injured structure, as well as performing functional tests and full range of motion and full strength. Prevention of these injuries. So how do we prevent knee injuries? There is quite a debate on that, but there are different things that we can do to prevent knee injuries. It's very complex, but we basically need to develop a physical conditioning, rehab, and skill development type exercises. If any of you are involved in club soccer, they're very much into preventative ACL conditioning and different strength training. It's changing daily. This is kind of one of those things that they're working on and trying to figure out. The science of rehab and kinesiology is here. So when we look at physical conditioning, we want to include all these components. So the muscles need to be strong but flexible. The joints need to be connected in the kinetic chain functionally and have the correct strength and flexibility to do all the different strengthenings that they need. For example, a football athlete's hamstring needs to be about 60 to 70% of the strength of a quadricep to be in proper balance. However, a lot of times that's more or less depending on the sport, depending on the person. So you can measure these where they're at and then know what to work on to try to prevent any injuries. Because if there's a large imbalance, you're at higher risk of injury. You want to strengthen the gastroc to stabilize the knee joint. You want to make sure that you have some type of proprioception and balance. All of this is different types of interventions. So a lot of times what will happen is you'll get evaluated in different movements. A lot of times there's videotaping involved and looking at what you do on proprioception and neuromuscular, and then they go and focus on those different things. So for instance, teaching people how to jump and land correctly. Realistically, you want to land on 2 feet at all times, soft landing to absorb the impact. You want to have a quiet sound. I understand it's not always going to happen, but if you can train your body to work on that, that's how you can kind of get through this. Instructional training techniques have been effective in reducing ACL injuries in collegiate athletes, female athletes, using proprioceptive balance boards have also helped. Neuromuscular training, meaning basically they're training their muscles in a certain way to decrease the injury rate and prevent these injuries. So football is a trend as a collision sport. So they use soccer type shoes. So you want to look at the shoe type, because if your shoes are not correct, it's going to put a stress on your knee. It's just going to go up. Shoes that are worn on artificial are different than shoes that need to be worn on real turf. Depending on the type of weather that they're dealing with, changes the cleat that are in the shoe. Shoes that have more and shorter cleats are better because they don't get stuck in the ground as much. A lot of injuries happen to when your foot is literally stuck in the ground. So you want to try to figure out what is the best option for you and what sport you're doing and what you're trying to do. Ideally, the longer the cleat, the easier it is to cut because it grabs that turf, grass, what have you, and it allows you to push off better to cut. But there's that fine line there because if it's too long, you're more likely to get that cleat stuck, and when you go to cut, you're going to twist your knee. So there's kind of a balance you have to find out. So you want to have, there's a research study out there that shows that soccer cleats that are used on turf, meaning cleats that are made for grass, i.e. a longer cleat, that when they use it on turf, it's had a higher incidence of knee injury because that foot gets fixed in the turf. So there are turf cleats that are different than grass cleats. So you also want to look at preventing with bracing. There's prophylactic braces and also functional braces. Prophylactic braces are those simple knee sleeves. Sometimes they have hinges, sometimes they don't. Functional knee braces, these are the harder, bigger ones. A lot of times you see them on linemen in football or people that have had ACL injuries. They're custom a lot of times, or there are some off-the-shelf versions, but they're very expensive. And so it's generally accepted that protective knee or prophylactic knee braces have little to no effect on functional performance. Now, I will tell you, athletes will tell you different because they don't like the feel of them a lot of times. They don't like the restriction of them. They slide down, different things like that. However, there is no research that upholds that thought. They just have to get used to it. Sometimes they rub, they chafe, so sometimes you have to modify, wear a sleeve underneath or add a pad somewhere, but there is no functional difference with them. So that's how you can rehab knee injuries as well as prevent as much as you can.